नमस्कार। आज हम अपने चैनल पर हमारे बहुत प्रिय पेशेंट हैं मिस्टर अखिल शर्मा, तो ये आए हुए हैं। तो हमने सोचा क्यों ना इनकी जर्नी जो है हम उसको आप तक पहुंचाएं, क्योंकि ये कनाडा में रहते हैं और कनाडा से इन्होंने ट्रैवल किया 2 बार, इनफैक्ट 3 बार। और इन्होंने हमसे जो है हमारी टीम से एक तो इनकी लंबर स्पाइन की सर्जरी की है क्योंकि डिस्क का इश्यू था, उसके अलावा दोनों एल्बोज की सर्जरी करें। तो आइए जानते हैं अखिल से कि कैसे वो हम तक पहुंचे, क्या इनको प्रॉब्लम्स थी और क्या सोल्यूशन के बाद, सर्जरीज के बाद ये कैसा आप महसूस कर रहे हैं और कैसा रहा। तो अखिल, हाउ ओल्ड आर यू?
I'm 27 now.
So you are settled in Canada?
Yes.
Which part?
I'm in Calgary, Alberta.
Okay. And you are by profession?
I can engineer.
IT. You have a wonderful family there. I've seen your pictures with your child.
Ji.
How old is he?
He's now 1.5.
1.5. So, Akhil, if I'm right, you first came to India in 2024.
Ji.
And that time you had a back issue.
Ji.
So, what was the problem?
Ji. So I was suffering from back pain. I started with disc herniation. I just herniated my disc while working out. It was a sudden burst of pain somewhere around 2019. After that, I was unable to sit, and then that pain became chronic, continuous pain, and it started increasing in duration and intensity. So I was suffering from it for the past 6 years. I tried to do physiotherapy. I tried to limit everything, in which I only resorted to swimming. But after that, the pain just kept on increasing, and life was kind of became unbearable in those 6 weeks.
So, it took, during that period, you were under treatment in Canada?
Yes. So I went through multiple rounds of physiotherapy. I went through a lot of injections to my psoas muscles and other muscle groups just to diagnose the source of pain. And then the last resort I tried for a non-invasive treatment was the stem cell injections, which I got in the US. I was in the US before, and nothing worked. And I think the stem cells probably made it a lot worse. After that, I was actually bedridden for the last 2 years, but then towards the end, it was just constant agonizing pain.
So, the therapy was given in which year?
It was given in 2023 August.
So after that, for 2 years, your pain became unbearable?
Yes, so 23 August, I got PRP. They gave me 3 months that it would work. It didn't work. Then they gave me a lot of extension exercises. The extension exercises, I think, made it a lot worse.
Which hospital was this in?
It was in Raleigh, North Carolina, but I don't remember the hospital name.
Okay. So here I would like to take a pause and ponder upon this PRP injections, which are now everybody in India also is advocated. As per me and Anand are concerned, we completely have no trust in these schemes. We think that it is a big financial burden on the patient to get a procedure done which is not going to offer any help. And in your story, we realized that after giving the injection, in fact, your pain became unbearable and you were unable to move. So, how did you then find Anand, Dr. Anand?
Yes. So, those 3 months with the stem cell PRP injections, it was kind of roller coaster of emotions because it was the kind of last resort. And when it didn't work and the pain became much worse, maybe due to a lot of physio and extensions and so on. So I then finally decided to go for a surgical solution, and then I started doing my own research. I didn't want to go for fusion because I wanted to remain mobile and make sure that I could play sports and maybe have an active life. And then I started looking for options. I started with YouTube shorts. What are the modern treatments available other than fusion? Then I stumbled upon ADR. And then I found out who does ADR in India, because problem the US system was they could make me wait for months and months. Even to get a doctor appointment, I used to wait to get my back looked at. If I was lucky, then I would get an appointment in the next 2 months. I didn't want to do that anymore. I mean, spending every one day was a challenge at that point of time. Then I stumbled upon Dr. Naik's page, and then I did my own due diligence on him. I found his old interviews, videos. Then I looked into his not only the website but other details. I did my own cross references. I found out at that point of time, I probably still is, that only he had the enough background info given on the lumbar areas which he did already. I didn't found it in other doctors or websites. There were hospitals which just advertised it, but I didn't see it when I looked into it.
So by lumbar ADR, I would like to add that it is anterior disc replacement rather than a disc fusion.
Yes.
So traditionally the surgery for back is done from the posterior aspect, where we go through the skin, the fascia, the muscles, and we take out a part of the vertebra to reach to the cord and then subsequently to the disc. Whenever we find that the disc is protruding out, we remove that from there and we introduce a fusion device from the posterior approach itself. After that, usually if we feel there can be an instability in the future, we like to put in some screws and rods. Why didn't this type of a surgery, which is traditionally the gold standard or considered the gold standard, was okay with you?
Couple of things. Fusion limited mobility, so I didn't want to limit my mobility. I have been very active and I wanted to continue active. It's like being active is part of who I am, it's part of my being. I wanted to go for that.
You are very much into functional training,
Yes,
and all.
yes, yes.
So you wanted to continue.
Yes.
So then you came in 2024 came there.
Yes. Yes. So another thing I wanted to avoid fusion was that ADR would distribute your loads to other discs, and ADR and fusion might transfer the load to other discs. I didn't want to have the scenario.
So you did a lot of physics, behind this.
Yes. Yes.
So being a engineer helped you with that. Anyway, so 2024,
Yeah.
after reading Anand's page, everything, you came and met him.
Yeah.
And your surgery was planned.
Yes.
So Anand, what level was the
technically, he was suffering with back pain, and it was purely axial back pain. Very rarely could radiate to his calf muscles or anything, and he reached up to a point that he was unable to move. I think that you have emailed me when you were lying down in lying down positions when we were having those discussions in early stages. He was always lying down and typing his email. And through Messenger, we exchanged a lot of things. He asked me a lot of questions. I've gone through his scans again. It was a black disc. If you look at those MRI scans, it's very easy to miss them. But there is some pathology because spine is a very dynamic structure. Black doesn't mean that they are bad, and it doesn't mean that they are healthy also at the same time. But you need to see it as a mechanism. It's like a shock absorber. So the inside the organization, which is known as the nucleus, the water content and the protein content, it reverses and it loses the ability to hold water and the viscosity of the nucleus.
Right.
So these are the people in whom the disc height is good. It's black in color. It can be white also in most of the people because there is a race.
Black and white, you mean the scans on the
MRI scans. So white means water or hyper intensity, and that represents a healing phase of the disc. So our body, there is a race between healing and damages. So eventually we discussed with him, told him that if it is an axial back pain, then only an anterior approach is the only technique which can give relief. Because if you do a traditional surgery, like you have said about the discectomy or the fusion, so I have to cut muscles, ligaments, facet joints and bone. So I am giving him a different kind of a trauma. These things, they are very essential. They are not culprits. The culprit is the irritation to the nerve because of the disc. So that's why the anterior approaches, they work really well in pure axial back pain.
So it was L5S1.
It was L5S1, and because that is the base, and L5S1 doesn't move a lot in flexion extension. It acts as a proximal distal distraction or a stabilizer, because from there the weight has to transfer through the iliac bone to both hips and go together. A lot of people, they change their posture. I was telling him today also that when one disc is gone, the stresses are transferred to the next one. And if we have taken care of L5S1 with an artificial disc replacement, then the L4-5, it will heal. We have seen in 3 years or 4 years after surgery MRI, if there was any damages at L4-5, it reverses. Even the facial hypertrophy at L5S1, it reverses. So artificial disc replacement is the only technique where the pathology can be seen there is a reversal of pathology, reversal of aging of the disc. And that's why these are the procedures, they stay longer. And probably with 40 or 45 plus years without having any pain. And whereas in the posterior, the drawback of the posterior, they are not bad surgeries, posterior surgeries, they are decent. The indication has to be right.
Yeah, we so many times have done procedure in practice also, wherever it is completely indicated. But with an ADR, obviously, it gives you a better chance at keeping that mobility. And for active individuals, young ones, especially like yours, obviously it takes a whole lot of load off the L4, L5, which is the next one to go, which is the the classical progression after a fusion has been done at a lower level. So now it's been 2 years. How have you been doing with your back?
Yes, fantastic. So the stress test for me was to able to sit for 30 hours during the long flight from Canada to here and manage it. Because when I injured my back, I was able to lie down or able to stand and work in the beginning, but sitting was the hardest. It was like it became impossible very soon. So I was able to sit for long distances and not think of any pain in my back. It's like it's changed. I kind of forgot how a pain-free life was, but then it's a kind of a second life.
So now that it's been 2 years, have you started working out?
Yes, I started working out only a couple of months after that, probably 3 months or so. I started working out. I started doing swimming. Started with some physio stretching, and then I started my daily routine.
So that was with your ADR, but then you came back to us, to our team, for your elbow problem.
Yes.
Can you please tell us what the problem was?
Yes. So I think it's kind of an anatomical issue I had with both my hands, in which my ulnar nerve, which is the nerve here, it subluxates whenever I flex, and the tricep muscle also kind of pushes it, and it used to cause pain. When I was in school, it was kind of an annoyance, but I could ignore it when I used to play a lot of racket sports. But when I started into other sports which could involve lifting weights, it started becoming painful. So after a couple of years, it became such a bother that I had to stop kind of a lot of activities, even playing sports such as badminton, just to not to irritate the nerves. And it was kind of in both the hands. I was initially told to just manage it. Physiotherapy did not help much. So I was told to manage it, not bend my arms, not do anything and pick it up. But with time, it started, that pain kind of increased, and it was started becoming chronic.
So when you connected with me, I think in May 2025 or June,
Yes.
over the video call, you had this specific thing that I have got bilateral snapping tricep syndrome. So basically, what is snapping tricep syndrome is that when the triceps tends to snap over the medial condyle of the humerus, and because of that bulk of the muscle coming in, coming more towards the inside of the elbow, it carries and pushes the ulnar nerve along with it. And in your case, it was bilateral. It's a rare condition. There are a lot of single cases, reported in medical journals, which suggest that this problem occurs. Even radiologists have reported this with dynamic ultrasound examinations or on MRIs where they have found out yes, this can happen. And there are various different people have suggested, different surgeons have suggested different kind of surgical approaches to these kind of problems. So when you talk to me, I saw your ENG NCV studies which were done there, and your dynamic ultrasound was also there, which we saw, and we discussed that yes, this is definitely a tricep snapping tricep syndrome, and your ulnar nerve is getting in a fix because of that, and you started having numbness and tingling over the ulnar half of the distribution over the hand on both the sides. And you said that I am just unable to do any form of exercise now, which involves either hyperextending the elbows or kind of doing a triceps workout for
Or
you.
even lifting my daughter.
Yeah, that was your major concern. I am not able to lift my daughter, and I know as a father that would be really worrisome. So then finally you came, and August I reoperated on the right elbow first for you, where honestly triceps is snapping. I have operated on a whole lot of ulnar nerves with anterior transposition for different problems, but this snapping triceps was my first case which I have seen because I haven't encountered anyone. So there are it's a developmental issue, obviously, and it is more associated with people who have a more varus elbow rather than a rhinoid elbow. That is the other thing. And second thing is in patients who have a very long medial head, sometimes developmentally, this problem can occur. So the two major concerns was first to decompress the nerve, not let it get into this kind of a normal movement which was causing the problem, and also managing the triceps. So we discussed a lot of options amongst ourselves that what needs to be done. And I came to the conclusion that if we are able to somehow take the medial head of the triceps more laterally, we turn it around, and also do an ulnar nerve decompression and anterior transposition, it is really going to help you. So the first surgery that we did on the right side was the same. I have shared the video with you as to what was happening. So whenever we were, bringing the elbow in from flexion to extension and back, the triceps bulk used to push the nerve, and they used to both get subluxated over this medial epicondyle and cause a certain kind of a snap whenever it was happening. And that snap slowly was causing the nerve to become more flattened and injured at that area. Every cycle of flexion extension used to bring about that. So we did the anterior transposition of the ulnar nerve along with the lateralization of the medial side of the triceps to ease that problem, and also some shortening of the medial side. It went well. I think you are doing fine. So after the first surgery, how have you been now for the past almost now it's been few months that we have done?
Yes, so the recovery was a lot quicker, especially compared to my back. So I mean, the snapping immediately stopped, and the pain was probably gone in 10 days or so. And after that, it's pretty good. I was told to do functional weight training or lifting heavy weights after 3 months, which I started doing it. But it was pain-free and symptom-free long before that, in the first 10, 20 days.
Yes, of course, because now the pressure was that normal mobilization of the nerve, mobility of the nerve which was happening has stopped. And then now you came back to us in October and operated on the left side for you.
Yes.
Here again we have done the same thing. We have done the anterior transposition of the ulnar nerve. Plus we have done the lateralization of the medial side of the triceps along with shortening of the medial head. Yeah, so this is where we start now. And I feel that in another month or so you can start doing the heavy training that you really want to do with TRX, with your functional training, plus the weightlifting that you want to start. You are a tennis player, right? Badminton player. Yeah. So you can start playing badminton also, because the right side is absolutely healed and fully functional now. So I think that you should, and I really want you to do because. And are you able to lift your daughter now?
Yes.
You are?
Yes.
But this left side now you will go back. Has she come with you? On this
Yes. my toddler is with me, and actually I'm able to lift him with my left hand as well, because it's I mean it healed a lot quicker and I was able to lift his.
That was because it was something which we have gone through.
Okay.
So mentally also it plays a part that yes, it will heal well. You already knew that because you've already undergone
Yes.
a procedure,
Yes.
and you are sure that this is also going to work and you are going to be pain-free. So the mind also tends to make you feel better quicker. So it's been incredible your journey with us, and it's been a pleasure doing what me and Anand have done to help you. And it's always happy to see a happy patient. So why we did this interview is because there are a lot of people who do not know what are the kind of surgeries that for the spine and otherwise for nerve that are possible, and what options are available now. It's not only some conventional procedure surgeries, but also disc replacement surgeries. The implants are available. The implants have been tried tested for a number of years, and now they are multiple. Now we have a series of hundreds and thousands of patients of ADR with us. We have series of ulnar nerve transpositions, and obviously we have 2 elbows now of snapping triceps syndrome also. So it's been a pleasure, and I hope हमारे जो viewers हैं उनको इससे थोड़ा सा आइडिया लगेगा कि ये सब सर्जरीज जो है वो पॉसिबल है. तो अखिल, थैंक यू वेरी मच फॉर स्पीकिंग विद अस. इट इज अ प्लेजर.
जी, मैं एक चीज एंड में ऐड करूंगा कि इफ आई हैव टू गो बैक एंड रिविजिट कि मेरे क्या डिसीजंस लिए, तो मुझे ये नहीं करना चाहिए कि मुझे 6 साल पेन के साथ बिताना चाहिए था. और मुझे ऐसा देखना चाहिए था कि यार कोई चीज 2 साल में ठीक नहीं हो रही है, 2 साल वो भी आप पे डिपेंड करता है कि 2 साल में इम्प्रूव नहीं हो रही है और धीरे धीरे वर्स हो रही है, तो आपको डिसीजन लेना चाहिए. तो टाइम के साथ चीजें और वर्स हो जाती हैं. जब जैसे पहले मेरे बैक के साथ बेरली मैनेजेबल था मैं, और उसके बाद वो बेरली मैनेजेबल हो गया और मैं कंटिन्यू पेन में जाता गया. मुझे इतना वेट नहीं करना चाहिए था. आई शुड हैव kept looking for solution.
I'll tell you one secret now, so that you have been so candid about everything, you have been so open about everything. I'll tell you something. I have 3 discs replaced in my cervical spine, and it has been done by this gentleman. And it started somewhere in August. I'm doing some exercise, martial arts that I do. And then the pain and the problem suddenly became very severe for me. In fact, my left shoulder was absolutely weak. And I was also, because 3-level cervical disc surgery. I am an orthopedic surgeon, nerve surgeon. We have been together for such a long time. I am there in most of his cases, assisting him. So, and vice versa. And I know that it is not an easy surgery to perform. And I had 2 things in mind. First of all, him doing the surgery on his colleague, his best friend, even emotionally it is a very big task to go ahead and do it. But anyways, he was up to it. I was a little scared. So I waited on it for some time. But in about 2 or 3 months I understood that there is no running away from this. I have to get it done because it is important not only for my profession, but in general in my life, because it was affecting my daily activities a lot. I was unable to sleep properly. I was unable to sit properly. I was unable to operate on my patients properly, and I was taking time off from work. Deferring my surgeries, my elective surgeries to an extent where I had to really, I was thinking whether I will be able to operate tomorrow or not. And within 3-4 months, I took a very smart decision. I am thankful I did it. Thankful to God that the surgery went well, and now it has been almost 2.5 years. 3 disc replacements. I am doing all surgeries. I am doing everything. There is no problem. I do all kinds of sports. I am playing tennis. I am doing my martial arts. I am playing basketball. I am doing 12-hour long surgeries, wearing my loops again. So you are absolutely right. You have to take the decision at the right time, and you have to choose the right person to do that job. Obviously, searching on Google, all those things help. But when you meet the surgeon, when you talk to them, you get a better insight on what all is available and what all can be done. So both of us from our side, thank you, Anand.
I would say, it's normal to be scared.
Yeah, I know.
A person is not scared, then he's not normal.
Yes, obviously,
Yeah.
all our patients are usually at one point or time they are absolutely scared. When we tell them, and I tell them कि brachial plexus की surgery होगी and it's a 12-hour long surgery. Obviously, he is going to be scared. As to, there are so many things in a surgical procedure that can actually be right, and then there are things that can go wrong over here. So it has to be a very, very thought-over decision as to get it done. But running away from it never helps. At least you tried your physiotherapy bit.
Yeah.
I also tried physiotherapy. I also did, going diligently for my physiotherapy sessions. They help in decreasing the pain.
Yeah.
But ultimately, when the surgery was indicated, there is no running away from it.
You know what Akhil has done is not wrong. He went to seek for his pain management, be it any technique. So he followed all the guidelines which were thrown at him, all kinds of treatment which were thrown at him, in a belief that he will get relief. So it was failure of one thing and the failure of another one, and that's why he started searching. So that was his experience. And same thing with you. You also were thrown with physiotherapies, injections, and lot of exercises, lot of things. So it's always try and test. One in 10 may get some benefit, and surgery could have been avoided for you. But I believe that it's always clinical examination. Let the clinician do a proper clinical examination, not simply looking at on the scans, not simply giving decision based on it. Okay, you can arrive to a conclusion that this is causing it, but it has to be supported with the clinical examination.
Yeah, when it is sometimes we miss on the MRI scan, because we can't treat the MRI scan.
Yeah.
I couldn't have treated your EMG NCD study which suggested that the nerve was gone. If I had, and you were also correct in asking me again and again when we did the first surgery, कि सर आप triceps का कुछ करोगे कि नहीं करोगे? And I told you I'll do something. I had a lot of ideas how to deal with it, but what I thought was the best workable idea at that point in time when I was operating, we did that and it worked. So sometimes we, tend to miss out things by when we have not examined the patient. If we just do an anterior nerve transpositioning, your problem would be persisting now because that triceps, which is snapping, is still going to give you some point of discomfort and pain, which was going to happen. So it was a wise decision to deal with both the things at the same time, and that is why right now the elbows are doing fine. Anyways, so it was thanks to both of you for having this chat. It was great, and hope you keep very well in the future. Thank you.
Thank you.